Hi everyone, today I shall discuss about an important topic which a person actually can go through it when there is an accident, that is a road traffic accident. Now there are some important region of the skull. This region is known as the pteridian. How this pteridian is formed? This is the frontal bone where the eyes are situated, and this is the squamous part of the frontal bone. This is the temporal bone, and this temporal bone, the squamous part of the temporal bone. This is the parietal bone, the anterior-inferior angle of the parietal bone, and here you will see the greater wing of the sphenoid. You see, this is the sphenoid bone. This sphenoid bone has got a lesser wing and the greater wing. This greater wing has got a orbital surface, and this greater wing, this part is the temporal surface. So this temporal surface comes in contact here. So this union of these four bones, or the junction of the four bones, is known as pteridian. You see here I marked this area by means of a plasticine. So this area is known as the pteridian. Suppose there is the road traffic accident. If this region is damaged, what will happen? Deep to it lies the middle meningeal sinus. So there is the hematoma within the outside the brain, and this is known as the subdural hematoma, and there is the subdural hemorrhage. And if any hemorrhage in the brain or the this meninges, what will happen? You will press the brain, and that portion of the space becomes suffer from nutrition, and there is the development of certain phenomenon or certain features due to the injury in this region. So this is the pteridian. Now opposite to the pteridian there is another region. You see this region, this is the junction of the three bones. One is the squamous part of the temporal bone, another is the posterior inferior angle of the parietal bone, another is the occipital bone. Now when you lies over the pillow, the occipital bone touches the pillow. So this squamous part of the occipital bone, these three bones, they form a junction, and that is known as the asterion. Now this asterion is related with the important sinus, and that sinus is known as the sigmoid sinus that passes in this region. This is the sigmoid sinus. Now this is the region of the sigmoid sinus. You will see I make a blue color area. So this part is damaged when there is the injury in the asterion, and that is very important area. It is related with the that is the ear, that means the internal ear. So if there is damage, so you see this is the sigmoid sinus, and if there is damage of the sigmoid sinus, the hearing process will be lost. So you will see this region is the asterion. So this region is the pteridian. Similar region present here, that is known as the asterion. Next portion you will see, that is the junction between the coronal suture, this is, and the sagittal suture. This area occupied by unossified membrane in case of fetus within the uterus. This is a skull of the fetus, and this is the area. This region is known as the bregma. So in case of adult, that is about 1.5 years after birth, the whole thing is ossified. But here you will see that unossified membrane, because during the birth passage one bone overlaps with each other. That's why the biparietal diameter reduces in size, and one can passes through the birth passage. So this is known as the bregma, this region. Why it has got importance, you will see in every, I means the Punjabi, in case of Bengali, and everywhere in case of Bihari, you will see that everywhere after 1 month of age they will do the mundan. 1 year, not month, 1 year of age they do mundan. That means the whole of the hair will be cut away. Why they cut the whole of the hair? Because you see, this area will be at that time that membranous form becomes more or less ossified. So by seeing this, whether this portion is still remains unossified and the ossification is late, by seeing this one can detect the baby will suffer from ricket or not. So this is the bregma and its importance. Similarly, you will notice there is unossified membrane in the region at the junction of the occipital bone and the two parietal bone, and this is known as the lambda. This lambda, it closes 6 months after the birth of the baby. So these are the important area one should know, and one should have know the emergency of this region. Thank you everyone.